alatawi, and today's topic is about high output heart failure. So it's a condition where your heart is overwhelmed by massive amounts of blood pumped by each minute, and this massive amount of blood, we refer to it as increased cardiac output. So when we have an increased cardiac output with long period of time, your heart would eventually fail. And one of the main causes, or let's say the main important cause for this condition, is decreased systemic vascular resistance. So anything would decrease your systemic vascular resistance is a contributor to this condition. So we have a list of causes. I did not include all of them. There are actually more, but these are the most important ones. The most important and the most common cause is morbid obesity. And according to UpToDate, they mentioned that there is no clear pathophysiology of how morbid obesity can contribute to this phenomena. It is just gonna cause vasodilation, and with chronic vasodilation, the patient will have this kind of heart failure. How does vasodilation happens? It's not actually clear. The second mechanism is AV fistula. So when you have like a shortcut between your arteries and veins, we call this a fistula. So instead of just going into the normal pathway, your blood just gonna go to this shortcut, and eventually will make your blood way more shorter, way more faster to return, and this will just exhaust your heart without any that much bigger of a benefit. The second thing is hyperthyroidism. When you're having, let's say, an abnormal thyroid gland secreting a massive amount of T3 and T4, we know that your heart is gonna have an increased heart rate, and this is gonna cause eventually increased cardiac output. And systemic vasodilation due to the waste products of your tissue. This happens because of your increased basal metabolic rate. Advanced cirrhosis will just in a straightforward way. I'm just gonna mention that it causes vasodilation, and chronic vasodilation secondary to cirrhosis would eventually cause your heart to fail. Thiamine deficiency or beriberi disease is when your your heart is lacking thiamine, or your body is lacking thiamine. Thiamine is essential for your heart to create ATPs, and the decreased amount of thiamine would eventually make your heart weaker. It won't pump as it should be, and your general circulation would be affected too. It will cause it to vasodilate, and therefore causing this kind of heart failure. So in a clinical presentation, we will find that this patient will have like an increased pulse pressure. So what is a pulse pressure? Pulse pressure is actually the subtraction between the systolic blood pressure and diastolic blood pressure. So let's just recap. These patients will have increased cardiac output. So cardiac output is stroke volume multiplied by heart rate. So if there is a high stroke volume, there's gonna be a high systolic blood pressure, and therefore having a high pulse pressure. You will have warm extremities, absolutely, because your blood vessel will vasodilate. You will have edema because it's a failure. It's of course you're gonna have like heart failure manifestations, and your PMI would be laterally placed. What is the PMI? It is basically the location where you feel the heart most. It is in your fifth intercostal mid clavicular line. So if you're gonna draw two imaginary lines between your fifth intercostal and your midclavicular line, it is just like above the nipple, 1 centimeter above the nipple. You will feel the heart here at most, but in this condition, due to your heart failing, there's gonna be some consequences like left ventricular left ventricular dilation, and this will shift this point into the lateral side. You will have a systolic flow murmur. It is, of course, it is due to the turbulence blood flow because you're having a high amount of blood pumped each time. When you place your echocardiogram, you will notice that both ventricles are dilated because your heart is failing, and the inferior vena cava is gonna be dilated too because there is gonna be an increased venous return to the decreased systemic vascular resistance and increased cardiac output, and your resting cardiac index is going to be increased. What is resting cardiac index? It is the division of cardiac output on the body's surface area. Normal value is 2.5 to 4. An increased value, I mean above 4, it means that your body is in a hyperdynamic state. And on the other side, if you are having less than 2.5, it means that you are in a condition where your blood not flowing well, like a sepsis or something similar to it. And that's all for our today's topic. I hope you enjoyed it. Please put a like if you liked it, and see you soon, inshallah, in the future. And bye bye.